Hi everyone, I hope you are all well. I'm Professor Ahmed Hankir. I'm a consultant psychiatrist in Canada, and I'm also an honorary visiting professor at the School of Medicine in Cardiff University in the UK. I identify as a wounded healer. So, as I said, I'm a consultant psychiatrist, a mental health care provider, and I'm also a mental health care receiver. I was a psychiatric patient. I am a person living with a mental health condition, a survivor, and that, of course, is nothing to be ashamed about. I want to thank the Global Mental Health Action Network for providing me with this platform to contribute to this event. Thank you, Dr. Antonis, and your team. Persons often ask me, how do we combat mental health related stigma? I mean, it's ubiquitous, it's everywhere. Where do we even begin? And I think a good starting point is the human heart, and to be brutally honest with yourself and to engage in introspection and identify any stigma that might be inside you and reject it. But also by providing persons living with a mental health condition a platform to vocalize our views. It should be nothing about us without us in relation to the provision of mental health care services and challenging mental health related stigma. But it seems that it's everything about us without us. We refuse to be silenced any longer. We refuse to remain silent. We have voices. We can speak for ourselves, and we will be heard. So, my talk is going to be about how we can harness the power of creative writing, storytelling to reject mental health related stigma and humanize persons living with a mental health condition, because many persons living with a mental health condition, including me, feel like we are being dehumanized. And we can harness the power of storytelling to humanize persons living with a mental health condition, because a story is data with soul. A story is data with soul. So I want to share with you all. I'm very proud of this. This is my my book, Breakthrough, a story of hope, resilience, and mental health recovery. And it was released in April, and it is available to purchase in major retailers, bookstores, Waterstones. You can go online. You can purchase it from Amazon if you're interested. And it traces my story as a person of color, as a man of color, and the acronym that's often used in the UK is Black, Asian, and Minority Ethnic, so it's BAME. But if you're from the US or North America, it's BIPOC, isn't it? Black, Indigenous, and people of color. We know that people of color are overrepresented in mental health care services. And it can seem that the narrative, the mental health narrative, is whitewashed in the sense that it doesn't feel like the voices of persons of color living with a mental health condition are included in the conversation. Sometimes it feels like we are excluded. And so this was an opportunity for me to reclaim my narrative and to share my story in my own words. I poured my heart and soul into this. And it was an opportunity not only to humanize myself and other persons living with a mental health condition, but also to dignify us. And I found it cathartic, actually, sharing my story. And what I'm going to do is I'm going to read some extracts from my book, and then share some reflections with you and some insights, and really kind of emphasize that we collectively need to reject stigma. It goes beyond reducing stigma. We need to reject stigma whenever and wherever we see it, because stigma is a major barrier to mental health care services, and consequently, many persons living with a mental health condition continue to suffer in silence despite the availability of effective treatment. So repetition is emphasis, and I'm going to repeat myself. Many persons living with a mental health condition continue to suffer in silence despite the availability of effective treatment. Now, if that was physical health, there would be outrage, but because it's mental health, there's a deafening silence. And we know that stigma is a major barrier to mental health care services. And so I really can't emphasize enough, we need to reject the stigma. And how do we do that? Well, the evidence is clear. If you look at the Lancet Commission on Ending Stigma and Discrimination in Mental Health, published in the Lancet in 2023, if I'm not mistaken, or 2022, but recently, and the principal investigator was Professor Sir Graham Thornycroft at the Institute of Psychiatry, Psychology and Neuroscience. As I said, the evidence is clear. It's when you make social contact with a person living with a mental health condition. Why? Because when you meet us, you discover that we have hopes and fears and strengths and vulnerabilities and dreams. Like everyone else, you discover that we are human beings. And so really want to emphasize that nothing about us without us, and we, persons living with a mental health condition, must be involved in the design, development, and delivery of mental health care services, of anti-stigma campaigns at every level. So here goes. So I did find writing my book, as I said, cathartic, and hopefully it might resonate with you. Right, so the opening pages, here we go. I start off with a quote from Dylan Thomas. Do not go gentle into that good night, but rage against the dying of the light. And the beauty and power of poetry is that it defies a single interpretation. And for me, my interpretation is that, we, persons living with a mental health condition, we are being stigmatized, we are being dehumanized, we are being shunned, we are being discriminated against. But I'm not going to go down without a fight. I will fight for my human rights, and I will fight for the human rights of persons living with a mental health condition. So here goes. If living with a mental health condition has taught me anything, it's that the cognitive capacity of the mind to receive and to conceive ideas is something that should never, ever be taken for granted. There have been periods in my life during which my mind was so shattered that it was unable to comprehend and concentrate and to produce any meaningful or coherent thoughts. Reading a book, let alone writing one, would have been an impossible task during those trying times. I am immeasurably grateful and extremely fortunate that I was able to recover and regain my cognitive powers. That being said, recovery, certainly for me, was a gradual, slow, and painful process that took many years. I, however, was one of the lucky ones. Far too many of us tragically continue to experience severe symptoms of a mental health condition, no matter what we do or how hard we try. I think of people living with bipolar affective disorder, schizophrenia and schizoaffective disorder, those held captive by paranoid and persecutory delusions or tormented by terrifying voices and visions. Persons at the behest of sudden and extreme fluctuations in mood, which can be hugely distressing to the degree that they are associated with the highest suicide rates. Many of us perhaps take for granted the stability of our moods and or are unaware of how immobilizing and disabling psychotic symptoms, delusions and hallucinations can be. I also think of those with dementia and other types of neurodegenerative conditions who are unable to express themselves due to the devastating fragmentation of memory. My heart breaks for persons living with eating disorders, which have the highest mortality rate of all psychiatric disorders. It weeps for those amongst us with anxiety disorders, such as obsessive compulsive disorder and post-traumatic stress disorder, the intrusive symptoms of which can be enormously crippling and debilitating. Not enough is being done for people living with these cruel conditions. Not enough awareness is being raised. Not enough specialist support, social care and mental health care is available. The quality of that care, when it is available, has also often been described as poor and inadequate. The human rights violations of persons living with a severe mental health condition and psychosocial disabilities and the stigma and discrimination they face is also another major issue and is a stain on our collective conscience. The catalogue of injustices goes on and on. A government is judged based on how they treat the most vulnerable in society. If we look at how people living with a severe mental illness are being treated, the government has failed spectacularly. This is unacceptable. We need to do more. We must do more. People living with a severe mental health condition have been let down for far too long and deserve better. We deserve better. More attention must be given, more resources must be allocated, more high quality and easy to access specialist support must be made available and must be provided. I dedicate this book to persons who cannot formulate and express their thoughts because of the severity of their symptoms and how injured their minds are, but also to those amongst us who are able to speak out, but who are stigmatized and shunned, and towards whom a deaf ear is turned. This book is dedicated to the voiceless individuals who haven't been given a platform to amplify their views and share their stories and testimonies, but instead are ridiculed and silenced. Our hearts grieve for you and go out to you and to your loved ones and to all those who provide you with informal support. You are the true mental health heroes, and you deserve so much more than a dedication. I hope this book raises awareness of your plight, but also of your dignity and grace as you continue to fight that good fight and as you rage against the dying of the light. So that's from my book, Breakthrough, A Story of Hope, Resilience, and Mental Health Recovery. How did I feel when I was reading that? I felt a crescendo of emotion. I was remembering when I was in that dark and lonely place and how hopeless I felt. And if you told me then that I would not only recover, but I would be the author of a book and I would be sharing my story with you, well, I would never have believed you. And it reminds me about the importance of hope. I mean, so much can be said about hope. And as I said, I felt hopeless. And I think it's important to plant the seeds of hope into the hearts, minds, bodies, and souls of persons receiving care from us. For maybe if you are a mental health care professional, you don't even have to be a mental health care professional to do this, to give people hope that recovery is a reality for the many and not for the few. I can't sit down here and say that everyone will recover, no, because that's not true. As I said, we are not doing enough for persons living with severe mental illness, and it's a disgrace. It's scandalous to say the least. But what I can say is that many, if not most, persons living with a mental health condition with the right support can recover. So it's really important to disseminate that message of hope and recovery to as many persons as possible. Some other thoughts that crossed my mind whilst reading my book: the importance of humility. To this day, the best psychiatrist I ever met, he's not actually a psychiatrist. I pay tribute to him, Professor Jed Byrne, and he very kindly provided me with an endorsement of this book. He's actually a surgeon. I woke up one morning to discover that my hometown in Lebanon was bombed in 2006. And I saw harrowing and horrific images of dead bodies strewn on the streets of Lebanon. And I feared that my family were among the dead. I tried to get through to them, but I couldn't. And I felt so powerless, and I felt overwhelmed, and I reacted. And I discovered then how utterly beholden we are to the power and mercy of our minds. I developed a mental health condition. The symptoms were so severe and debilitating, I was forced to interrupt medical school and repeat 2 years. And when I needed care and compassion the most, I received ridicule and rejection instead. So debilitating though the symptoms were, the stigma was far, far worse. I did feel dehumanized. That's no exaggeration. I felt brutalized. But the person who listened to me and who dignified me and who gave me that safe space, that sanctuary, Professor Jed Byrne, he was the dean of the teaching hospital at the time. And I just remember the humility that he had. I remember asking him, does he know what it's like to wake up in the morning to discover that your hometown has been bombed? And he said, no. It wasn't only what he said. He had the humility to say, no, I don't know what that's like. But it wasn't just what he said. It was the tone of his voice, his body language, the nonverbal communication. He didn't place himself on a pedestal. And if I'm entirely honest, it does feel like there are members of the medical profession, the psychiatric profession, that do place themselves on a pedestal, and you know that I don't think that's going to help. I think it's humility. We need humility, more humility, in mental health care, in medicine, in this world. So that was a reflection that I wanted to share with you all. So as I said, I'm a person of color, I'm a man of color, and we can't be naive, we can't be oblivious to the fact that racism is real, it exists. I mean, there was a survey conducted by the British Medical Association. It was a decent sample size. I think there were at least 1,000 participants, doctors. 75% report that they were the victims of racism. And we know that mental health care services are overrepresented by people of color. I mean, you're more likely to be detained under the mental health care if you're black compared to if you are not black, under the Mental Health Act rather. Other things like you're more likely to get a psychiatric diagnosis of schizophrenia, you're more likely to be started on antipsychotics, and you were less likely to receive psychotherapy. And I think to say that racism doesn't at least play a part, I don't think that's true. So that's something else that we need to address in mental health care. Racism, I spoke about the stigma, I spoke about the discrimination, I spoke about the importance of humility and connection. Often, when I'm working in emergency psychiatry, and for example, when I was an SPR, I was at St. Thomas Hospital in Westminster in central London. You get the phone call from the psychiatric liaison nurse as a person who has been placed under a 136, a police power, section 136, and the nurses think that this person meets the criteria to be detained under the Mental Health Act. And when I meet them, these persons are often lonely, isolated, and socially disconnected. And I talk about the importance of connection. It's not the quantity of those connections, it's the quality. And all we need is like one high quality connection. And the persons receiving care from me in a mental health crisis, they don't even have that one connection. And that's heartbreaking. That's heartbreaking. And then that also reminds me of how I draw more on my personal experiences or my personal expertise. So persons living with a mental health condition, anyone living with a mental health condition can identify as an expert by experience, an expert by personal experience. And if you're a mental health care professional, anyone who's a mental health care professional, consultant psychiatrist, for example, can be considered an expert by professional experience. And so if you're a mental health care professional living with a mental health condition, you can identify as an expert by personal and professional experience. And the acronym we coined is EPPE. It's just this acronym that I coined with my dear friend, Professor Andreas Martin at the Yale School of Medicine in the US. And the point I'm trying to make is that at 2 o'clock in the morning, when I'm providing care to a person in a mental health crisis, I don't draw on my professional expertise as much as I do on my personal experience and expertise. And I just feel like, and there's reciprocity as well. I'm not the only person who feels it, because I've had persons receiving care from me say to me that I'm the first psychiatrist they feel they can connect with, that have that kind of authentic connection with. And it's because I draw on my personal experiences, my personal expertise. The point I'm making is that it's not entirely disadvantageous. Don't get me wrong. I mean, the symptoms, as I said, can be debilitating. And I mean, I was in a dark place. I don't ever want to go back to that. I don't ever want to go back to that dark place. I just want to be clear about it. I don't want to like romanticize this. But my experiences have made me more insightful and more empathetic and more driven as well. And I feel like I do have authentic connections with persons receiving care from me. And that's what I draw on at 2 o'clock in the morning. For example, like it's not written in the psychiatric textbooks. When I remember once, so I'll share an anecdote with you. I was talking to a person living with a mental health condition. And I said to him, at the moment, it seems to me you're not living. It seems to me that you're existing and not living. And apparently, he was like mute. He didn't make eye contact with anyone. And the moment I asked him that question, he made eye contact with me. And he just nodded his head. He didn't say anything. And as I said, that's not in the psychiatric textbooks. That's how I felt. And I talk about this in my book. And I'll share another powerful anecdote with you about racism, a specific type of racism, Islamophobia, which unfortunately, like anti-Semitism, these are growing problems. And we need to collectively combat Islamophobia and anti-Semitism in the same way that we need to collectively combat stigma whenever and wherever we see it. So in the psychiatric intensive care unit, I was asked to see a patient, and they were about to administer rapid tranq. They physically restrained him. And I heard someone say he's a terrorist. I kid you not, he was holding a copy of the Holy Quran. I don't know who said it. And they were about to chemically restrain him, and I said, please stop it. Let me try to connect with him. And so I said salam, peace. And apparently that's the first time he made eye contact with anyone. He didn't respond, but he made eye contact with me. And I said to him, I noticed that you're carrying a copy of the Holy Quran in your hand. Does reciting from the Quran, does that comfort you? And he nodded his head. And I invited him to recite the Fatiha, the mother of the Quran, in unison with me. And he accepted my invitation. And so that's what we did. And whilst we were reciting Fatiha, tears started to stream down his face, and he de-escalated, and he was exhausted, so he fell asleep afterwards with a smile on his face, without the need for any rapid trank. And that's just another, I guess, powerful anecdote that I wanted to share with you, which is also kind of in my book. And I think it illustrates how, unfortunately, Islamophobia has infiltrated mental health care provision. As I said, there was a member of staff, I don't know who it was, but I swear I could hear that person whisper he's a terrorist, just because he's Muslim or he was holding a copy of the Holy Quran. But also I feel, how we don't, more often than not, and Dr. Michelle Funk, my dear friend at the World Health Organization, she's very passionate about this because she pioneered the WHO Quality Rights, which is an alternative approach to mental health grounded on a human rights framework. I highly recommend everyone complete the e-training. It's free. And I'm sure Dr. Funk would argue that it's not even necessary. And there are, for example, in Merseyside, I forget the name of the trust, and it was actually the former president of the Royal College of Psychiatrists, Dr. Adrian James, who shared this with us, that there's a trust in Merseyside that has zero coercive practice recorded. So maybe Dr. Funk at the World Health Organization has a point, that we don't need coercive practice in mental health care. Just talking to someone on a human level, having that humility, going down, instead of placing ourselves on these pedestals, speaking to this person, going down to them on their level. And sometimes that's literally sitting down on the floor with them. I've done that before. Look, I don't have all the answers. I'm sorry. I'm really sorry if I've said anything that has upset anyone or offended anyone. It was not intentional. But I want to be receptive to your feedback as well and your comments, because I want to be able to incorporate the feedback. I hope it's coming from a good place. I hope the words that I'm sharing with you all, I hope the words are coming from a good place, and we can all grow together, because we are on this path of discovery, and I want to be the best version of myself that I can be, and we need to provide the highest level of care to persons, to patients, to persons living with a mental health condition, because in the same way that we have expectations that persons living with a physical health condition have the highest quality of care, persons living with a mental health condition also must receive the highest quality of care. Okay, well, I hope you found that helpful. Thank you for joining us all. When this moment becomes a memory, please reflect. I hope I was able to engage both the mind and the heart, and we can do that by harnessing the power of storytelling. But when this moment becomes a memory and you reflect on it, you have an opportunity. You can be an agent of change. You can reject the stigma, combat the stigma, or you can perpetuate it. And perpetuating stigma isn't an option. It's incumbent upon all of us to reject the stigma. So I'm inviting you to stand in solidarity with us, to contribute to this cultural revolution that empowers, dignifies, and humanizes persons living with a mental health condition. Okay, thank you again, and please protect your minds and protect your hearts. Bye for now.